Good morning. It's Congressman Jamie Raskin coming at you from Maryland's beautiful 8th Congressional District in Montgomery, Frederick, and Carroll counties. Welcome to our 6th annual Federal Employees Health Benefits Forum and the final one that I'm doing for the 117th Congress. The federal benefits open season for 2023 started on November 14 and will end on December the 12th of this month. In prior years, this crucial event we have held at the Holiday Park Senior Center, which is always our favorite place to go. Things changed with COVID, and I very much look forward to us getting back together again there in the future with our good friends from Maryland NARFE and the reps from the different insurance providers. But this presentation today that we're doing over Zoom will be available on my website at raskin.house.gov. And I'm thrilled that, again, that we are convening a phenomenal panel of experts, really the foremost people in the field. And before I begin with them, I wanted to share a few high-level updates relating to the federal workforce for our audience. I am proud to represent more than 80,000 federal workers and retirees who live in the 8th CD, and I'm dedicated to ensuring that all federal workers and retirees are treated with respect and that they get all the benefits that they have worked for and they deserve. President Biden has proposed an average 4.6% pay raise for federal employees in 2023. If we enact this, it will be the largest raise for federal employees since 2002, in 2 decades. This raise would be a meaningful step in the right direction for our federal workers, but it's still not enough to fully compensate for the rising costs that families are facing these days, or to ensure that the Fed jobs stay competitive with the private sector. Please know that I'm on the case and I will keep fighting for better pay and benefits for all of our devoted federal employees throughout Montgomery, Frederick, and Carroll counties. Turning now to retiree COLAs, as I'm sure many of you are aware, in 2023, there will be an 8.7% COLA adjustment for federal retirees under the civil service retirement system, and a 7.7% increase for federal retirees who are under the FERS system, or the Federal Employment Retirement System. I'm a co-sponsor and a champion of the Equal COLA Act, which would fix this unfair 2-tiered system and ensure that FERS retirees receive the same cost of living adjustment as other federal employees. Finally, I agree with President Biden that the federal government must be a model employer. I applaud the president for ensuring that all federal workers, including contractors, earn at least $15 an hour. And I appreciate his administration's ongoing efforts to inform federal employees of their collective bargaining rights. I look forward to continuing to work together with this administration to protect and empower all of our federal workers and our retirees. Now, to today's panel, we've assembled an amazing group of experts who are ready to discuss the various federal employee health benefit plans and other options that are available to you. Each speaker has been asked to speak for around 5 or 6 minutes, and the program should end by, well, we'll see when it ends, but I'm trying to be as succinct as possible, and I know our guests will be too. I want to start by welcoming Ed DeHarde, who is the Deputy Associate Director of Healthcare and Insurance for the Federal Employees Insurance Operations. I may have mangled that a little bit, at the Office of Personnel Management. He's got a very important job. He's worked for OPM for more than 20 years, and before joining OPM, he worked in the disability branch of the Social Security Administration. So, Ed, I'm going to turn it over to you for your contribution.
Thank you, Congressman Raskin. I'm sorry, everyone. My voice is a little raspy, but I'll try to speak as clearly as I can, and I'll try to speak quickly. As Congressman Raskin said, the federal benefits open season for 2023 will begin November 14 and end on December 12, 2022. The open season gives federal employees, annuitants, and other eligible individuals the opportunity to review their plans, make changes, and enroll in all of our programs for which choice, FEHB, FedVIP, and the FSA Feds program. OPM continues to work with the FEHB carriers to combat COVID-19. Throughout the COVID-19 pandemic, carriers have provided quick solutions for access to testing, vaccines, mental health benefits, and telehealth, as well as encouraging our enrollees to get vaccinated by offering incentives. The FEHB program is market-based, centered on choice and competition. Major cost drivers of our program align with those experienced in the commercial market, such as pharmacy spending, including expensive specialty drugs, the cost of treating chronic illness, and advances in medical technology and innovation. The FEHB program provides health insurance for greater than 8.2 million federal civilian employees, annuitants, and their families, as well as tribal employees and their families. The overall average increase in premiums this year for the FEHB program for 2023 will be 7.2%. Now, that's government share and employee share combined. So because of the way that the share works, the employee share can be higher, but this is why you need to shop. This is the announced premium increase on average. There are options available to everyone that can probably mitigate some or all of that premium increase, and you need to shop and make sure you can get value for your premium dollars. This is the what I think is the genius of the FEHB program. There's a rates chart shown on opm.gov that provides the actual dollar premium increase for each FEHB plan choice. You can also look on the back of the FEHB brochures, which are available on the website, opm.gov, and you can use the FEHB plan comparison tool on the website. The premium increase for our plans this year is in line with similarly sized large employers. COVID-19 has introduced unprecedented volatility in rate setting. A large part of this rate reflects claims experience in late 2021 and early 2022. In 2021, the coronavirus pandemic cost the FEHB program about $2 billion, or 3 to 4% of 2021 claims. The largest contributors to the 2023 increase are higher than expected utilization in outpatient services and facilities, increase in utilization of professional services, and increased utilization and unit costs in specialty drugs. Getting to the choices available to you, enrollees living in the DC metropolitan area have 37 plan options. So there are choices available to you that may be better than the choice you're in now. We get a lot of questions at these forums concerning Medicare. FEHB carriers continue to address and respond to the needs of our annuitants who are also Medicare beneficiaries. There are FEHB plan choices that offer Medicare Part B incentives, either through copay, coinsurance, or deductible waivers, or Part B premium reimbursement. The FEHB plan comparison tool makes this information available to enrollees and identifies plan choices with a Medicare B incentive. PCT includes a display that allows individuals to see exactly what they are expected to pay if they have both Medicare A and B as their primary coverage and FEHB as their secondary coverage. There are new options available in the area this year for which individuals who are enrolled in a Medicare Advantage plan of that carrier will get premium reimbursement. So there are 4 new options of that type, and there already were multiple options in this area. So if you are enrolled in Medicare and enrolled in FEHB, these are definitely options that you want to consider. I won't make a recommendation. We offer the market, we offer the program, and we give you a lot of information. So hopefully you can make the best choice. Walt may make some recommendations to you in these areas. Real quickly, getting to the benefits. For 2023, we've done some good benefit enhancements. We've expanded coverage for countermeasures against COVID-19, such as over-the-counter tests, booster doses, therapeutics, and pharmacy access to these therapeutics. We've addressed inequalities in maternal health, including expanding coverage and services in support of prenatal and postpartum care. We've provided options for assisted reproductive technology. That's something we're going to continue to explore moving forward. We've improved access to gender-affirming care and services for transgender and gender-diverse individuals. We've expanded preventive services including access to USPSTF, United Services Preventive Task Force, A and B rated preventive services throughout the year as they become available. We've expanded initiatives during this pandemic related to telehealth, and we've provided enhanced coverage of FDA-approved anti-obesity medications. We also have enhanced our coverage of medical foods, and this has all been done at very minimal cost to the program. Real quickly, you also have choices related to FedVIP. We have marvelous news in FedVIP. The average premium increase for the dental plans this year is 0.21%. The average premium decreased for the vision plans, and the average decrease is 0.41%. And again, that is a decrease. In the FedVIP program, we have eliminated waiting periods for orthodontic services. We have enhanced benefits targeting pregnant enrollees for wellness and education. And we have enhanced the availability of teledentistry services. We have also improved the member communications there to ensure the use of inclusive language. There are 23 dental plan options available in the program, and 14 of which are nationwide, and there are 10 nationwide vision plan options. And that's all I can say for now. As we move forward in the presentation, I may be able to give you some information on specifically how you can enroll, and also some things that you should consider as you go to the opm.gov website and look at our plan comparison tool and form the basis of the decision that you will make. Thank you all for coming to this forum. And as Congressman Raskin said, I look forward to the day that we can come back to the Ferrara Senior Center and see everyone in person.
Ed, thank you so much. That was awesome. I want to next welcome Tammy Flanagan, who is the benefits expert for NARFE. Tammy has spent 30 years helping federal workers take charge of their retirement by understanding their benefits. She provides individual counseling as well as online training for the NARFE Employees Association, Plan Your Federal Retirement, and the Federal Long-Term Care Insurance Program. Tammy, over to you.
Tammy, you're on mute.
I kept telling myself unmute. Oh, well, I'm sorry. Thank you again, Congressman Raskin, for this opportunity. I'm excited to be here. I think you have three people, probably the only three people in the world who get excited about open season, because we like to share information about all the changes and the fact that the premiums, even though going up, not going up too terribly. And if you do take a look at open season, you can look around at other plans. I mean, who in the world has 30 or 35 choices of health plans to choose from? I think in many cases, if you work in the private sector, it could be two choices called take it or leave it. So I think that federal employees and retirees do themselves a great service by taking advantage of the comparison programs that Ed talked about and Walton's going to talk about when he's finished. Those make it a little bit easier to narrow down your choices. Because as much as it's nice to have that many choices, it's almost paralysis by too much analysis, and we throw our hands up and we stay with what we had last year. So if you can narrow it down, my advice is always try to get yourself 3 plans, 4 plans that look similar, that look like they're going to work for you, and then really dig deeper. You can go to the plan brochures that are all available online, and you can search them. If you have a need for a specific chronic illness that you're treating, or if you're trying to get pregnant and you need those nice new benefits that Ed talked about for maternity and pregnancy, those are things you want to really zero in on to see which one covers it best. Or if you're someone who wants alternative care, such as acupuncture or even massage therapy is covered in a few of the plans. So if you're looking for something specific, you've got a lot of choices, and you might find that even though the premiums might be similar, the deductibles could be different, the copays can be different, and what they cover obviously can be a lot different. I'm addressing the Medicare issue because with my relationship with NARFE, the National Active and Retired Federal Employees Association, we do have most of our membership, I think, is really retirees, and many are with Medicare. And the biggest question starts off with, why do I even need Medicare if I have federal health insurance for the rest of my life? And the fact of the matter is your health plans will cover you if you don't enroll, especially in Part B, because that's the one we get concerned about because of the cost. So you do have the option to just stay with your federal health plan and use that for your care. But I want to encourage you to look at the option of adding Part B. Even though you're 65, you're still traveling, you're still going skiing, you're still doing all these things because you don't have those chronic conditions. Think a decade down the road, 2 decades, 3 decades, you may have 4 decades ahead of you at age 65. And that's when Medicare is going to come in more and more handy, because in our later years, generally our health doesn't improve. We may encounter a chronic illness or 2 or even 3. And that's when you're going to see the beauty of having that dual coverage. I was comparing, just for an example, and this is by no means the only plan that works well with Medicare, but just because so many people have the Blue Cross standard option and the Blue Cross basic option plan, the difference in premiums on a self-only enrollment is $120 a month less for the basic plan. And the basic plan gives enrollees an $800 reimbursement for their Medicare Part B premium. So when you divide that savings by 12, that's another $66.70 a month in savings. So you're really seeing a big difference between the cost of standard and basic option, basically really covering the cost of Part B and that difference. And the benefit of having that basic plan with Medicare A, which is inpatient care, and Medicare B, which is your outpatient services, anything from physical therapy to lab work to your doctor visits. When you have that dual coverage, you're pretty much covered 100% with the exception of your prescription drug copays and your dental and vision, which you can certainly use FedVip to fill in those gaps. So I really encourage retirees, especially where Medicare becomes your primary payer, your federal plan becomes secondary, and it's a wonderful combination going forward in life. Your fixed costs are going to be a little more initially, but down the road, the savings should more than offset that. One of the big issues I'm finding with a lot of our federal retirees, they do have generous retirement benefits. They've saved really well. Those who've been covered under FERS have a wealth of savings, and they find that they're sometimes affected by the IRMA, the income-related Medicare adjustment amounts. And that makes the decision even harder to add Part B, because now we're not seeing necessarily a savings by adding Part B. We're seeing an additional premium that's not offset just in the switching of a health plan. So we again have to think down the road to say, is that extra cost worth the peace of mind of knowing you now have that wraparound coverage? I know I give Walt credit for coining the term wraparound coverage, which means your plan doesn't charge you a copay, a deductible, or co-insurance, because they waive all of that when Medicare is primary. And many of our federal health plans will do that for you. The other thing I wanted to mention before I sign off is that Ed mentioned the Medicare Advantage options that are available in many of the FEHB plans, more so this year than even before. And this is all new to federal retirees. You know, we hear about Medicare Advantage plans when we watch television. We hear them just about every other commercial this time of year because they're holding an open season for Medicare Advantage as we speak. However, we don't know enough about them yet as far as, are they going to work for me? You know, we don't have our friends who necessarily have them. So I think there's a little bit of caution. So if somebody is interested to try those, because they can be a very good deal, you know, the price is right. There's no additional fee for that added benefit when you add it to your FEHB. Try it for a year. If you don't like it, guess what? There's another open season next year. And even if you don't want to wait till next year, your plans will allow you to drop out of that enhanced benefit and go back to the underlying FEHB plan, even if the year is not over. Also, one last point, retirees have an open enrollment of their own that they can use once in a lifetime. When you reach age 65, there's a qualifying life event designed to work with the Medicare enrollment. But if you didn't use it at age 65, you can use it at some other point in your life. And that allows someone who picked a plan or didn't look at their existing plan and realized in January or February that, oh my goodness, you know, this is not the best plan anymore, and I don't want to have to wait till next year. you can use that qualifying life event. It's actually 2L if you look at the OPM form 2809, and that will let you switch plans. So you're not stuck. It's not something that this is irrevocable. You can always change coverage. I encourage people to shop around. In the work that I do, I like to know what I'm talking about. So I've put my family through probably 20 of the 30 federal health plans over the course of the last 30 years. And there wasn't a bad one in the bunch. There were some that worked better for us than others. So nothing is going to be a life-threatening decision. You have catastrophic protection. You have preventative care in every single plan. And most of the plans work really well with Medicare, but some do work better than others. So I encourage you, when you face that to be or not to be decision, to really shop around, because the plan you're in may not be the best plan for you going forward. And that's okay, because you do have all those choices.
Thank you very much, Tammy. That was awesome. I appreciate your presentation. Finally, very pleased to welcome Walt Francis, the famed consultant and author of Washington Consumer Checkbook's Guide to Health Plans for Federal Employees. Walt has worked at the OMB in the Office of the Secretary at the Department of Health and Human Services, and is a consultant to the Centers for Medicaid and Medicare Services. He pioneered the comparison of health insurance plans from the consumer's perspective as principal author of the annual Checkbook's Guide to Health Plans for Federal Employees. He's testified before Congress numerous times on the performance of all the federal employees' health benefit and Medicare programs. Walt, I turn it over to you.
Thank you very much, Jamie. I think my predecessors have done such a wonderful job. They both have. It's not just that they know the program so well, but that they pinpoint things that you really ought to pay attention to. I will have to be a little bit repetitious, but I'll try not to be too much, despite the fact they stole most of the important points. As you heard, there are over 30 plans available in the DC metro area to federal employees and annuitants. The average increase is almost meaningless in that context, because there are plans that went up more than average and less than average. There are even a few whose premiums went down. You don't have to suffer the average increase, okay? That's the only good thing about it, though, is it may stimulate you to rethink your plan choices. Everyone every year should, at the very least, check the brochure of the plan you're in now to make sure there's no bad news in it. There may be bad news from a year or two ago that you didn't even know about because you hadn't bothered to look at the brochure last year. But there's a section in the brochure, how the plan changes. There are things, the plan changes, that aren't mentioned in that section, particularly the Medicare related things. The amount that your Medicare Part B premium is subsidized may go up. I haven't seen any of those go down yet, but in theory, in the future, that could happen. So there are things you need to check just to have peace of mind. I did my homework. Downloading a brochure is easy. You can do it at the Checkbook website. You can do it at the OPM website. You can just go straight to your plan website. They all have the 2023 brochure. And all those brochures are organized and formatted in the same way. So if there's a problem you're concerned about, chiropractic, maternity coverage, hospital deductible, whatever, it's easy to look it up. And you'll find you can compare 2 or 3 brochures side by side. Point 2, do consider how your health circumstances are changing, you and your family. The plan that was best for you this year may not be anywhere near the best next year. Don't assume that all plans are equal for your illness, okay, or medical condition. They're not. Another homework point, be sure to talk to your physician if you expect some, a specialist physician, because you anticipate a particular procedure next year. My favorite example is maternity coverage, okay? There are any number of plans that charge you $0 for having a baby, pre, post, or during delivery. you want to be in one of those plans. How do you know which ones they are? Well, you can look at the brochures, but you can also call your gynecologist's office and ask, in which plan is the gynecologist in next year, and what's the best one that she or he would recommend. So a phone call or two can make a huge difference in your situation next year. So all those homework things need to be done. None of them take a long time. They just require spending, half an hour or so of your life to get to that point. But I urge you to go farther, because there are so many choices that people don't even realize they have. GIHA now has 5 different plan options nationally, okay, and obviously in the DC area. Blue Cross has 3. Okay, Aetna and United each have half a dozen or more. So why aren't you looking at one of those name brand, top of the line healthcare plans to see which one may work better for you next year? You don't need to try to research all 30 plus options. Just take a look at, for example, the example already mentioned. Compare, if you're in Blue Cross Standard, compare it to Blue Cross Basic. And almost everyone will see there are considerable savings to be had by moving from standard to basic. But there's another option called FEP Blue, and you may or may not want to enroll in that one, but you could take a look. One family of options that most people don't even know exist because they haven't paid attention are the plans that have, quote, high deductibles with health savings account options. There are half a dozen of those available to you. It's complicated, and I don't want to try to go into the details here, except to say, if you just look at the brochure or go to the OPM or Checkbook websites or both, you can read how those plans work. The important thing is to understand that they are actually investment opportunities. There's something called a health savings account you can join. The government and the plan put in up to, for family, a couple $1,000s in some cases, and you can add thousands more, which is tax preferred. So you're reducing the amount of federal, state, and Medicare and Social Security taxes you're going to have to pay next year, which is effectively about a 30% discount off the money you invest in the health savings account. It goes in tax-free. You can invest it for years to come tax-free. The earnings growth is tax-free. And when you take the money out for healthcare expenses, it comes out tax-free. So I like to call it like an IRA on steroids. And if you're maxing your federal thrift plan contributions and willing to try to save a little bit more, being in a health savings account through a high deductible plan is a great choice. It is possible over time to have an account that winds up being in the many tens of thousands of dollars without even exceptionally good luck. Let me just also reiterate, there are more plans every year now adding. I'm now back to the people with Part B, annuitants, or people who are thinking about getting Part B, okay. There have been for many years the wraparound benefits where if you have an FEHB plan, particular FEHB plan that provides this benefit, and Medicare Parts A and B, you pay nothing for hospital or doctor. We add now to this witch's brew the plans that pay almost all or most of your Part B premium if you join them, and there are a dozen or more of those. Okay, now, and then the latest kid for the fest are these plans that you enroll in the FEHB plan. United and Aetna have particularly good examples of this. And you then also enroll in Part B, or you assign your Part B benefit to the plan. They will pay all or most of it. You will pay zero for hospital and doctor. You'll get a better drug benefit than you've seen yet, probably in any plan you're in now. So the question is, what's to lose? And as Jamie pointed out, you get a once in a lifetime chance to change plans even outside of open season. You can always change plans in open season, but the early but scattered reports are that these plans work pretty well. They're a little bit tricky. It's a little bit of a leap of courage to join one of them, But I strongly recommend that if you're at all frisky as a senior, and I think most people in Montgomery County are, take a quick look at one of those plans. Let me stop here. The advice you're getting from all three of us is advice on how to save money while improving your healthcare coverage. Okay, it is easy to do both. And I strongly urge you to spend a little bit of time doing some homework to see what good surprises may await you.
Well, that was terrific. You know, every year when we do this, I start off by thinking, why don't we just ask Walt and Ed and Tammy what they signed up for, and then we'll all sign up for that. But then your guys' advice always reminds me everybody's situation is individualized and everybody has different kinds of needs, and yet you've given us really significant considerations for everybody to take into account. If people do want to have more individualized counseling on this, because it turns out it is a big decision that deals with both your healthcare and your financial health, what should people do if they feel like ultimately they can't decide, say, between 2 or 3 different plans?
Well, you want to tell me?
A couple of quick thoughts. One is, it doesn't hurt to call the plan. They have people on call, 800 numbers, you know, who will answer any questions and, you know, or deal with any uncertainties you have about a particular plan. Of course, they want you to join the plan. They're salesmen as well as an advisor. So take that into account. You can talk to friends and neighbors, but you got to be, again, they'll have your best interests at heart, but they may not know about the good things or bad things about plan options you have. You can talk to OPM. They have a limited ability. They're not supposed to recommend plan A over plan B. So they have to be a little bit constrained, but there are plenty of problems they can help solve. And they're very competent at that. If you are a Checkbook subscriber, and by the way, about a third of all federal employees already have free access to our guide. So, you know, you could go to our homepage and just see if your agency pays the subscription costs. But regardless, we will answer any question that we get from people who've used the guide and didn't already find the answer. We like to think we've already given you most of the answers through our website advice. And I think OPM and NARFE, by the way, also both offer, and especially OPM, website advice, mainly by providing neutral, accurate information. So you can get help. There is a program that gives seniors advice that's Medicare related, okay, that's available in Montgomery County, for example. Got a mental block, maybe someone could, anyway, it's a Medicare. If you Google Medicare advice, you'll find it. It's funded by the Centers for Medicare and Medicaid Services, and you can get help there too.
Awesome. Ed and Tammy, do you have any final words for us, Ed?
Tammy, I think, wanted to say something specific to your question. I wanted to clarify where Walt talked about HSAs. The HSA tax benefit is only for active employees receiving salary. So for annuitants, they don't qualify for an HSA, but they get a similar benefit called an HRA, but that's only a benefit of the health plan. That's not investable money that they can have. So that HSA benefit is primarily for actives. It's similar to the FSA. And I wanted to mention too that for the FSA, you need to make a new election every year. So that's something people want to think about. But Tammy, I think, had something to say on this question.
Awesome. Well, thank you for that clarification. It was a lot of acronyms, but it was still clear to me anyway. Tammy, what about you?
Yeah, well, one thing I will say about retirees, there's that middle ground of being retired before you're 65. And we did have an HSA until we turned 65. So I think the distinction between an HSA and an HRA is if you don't have any other health insurance. So if you're not covered under Medicare, if you're not covered under TRICARE or a spouse's health plan, you can still fund an HSA according to the IRS rules. So that's a good thing, because
that's a good thing. Yeah.
Yeah, because we tried that one out too, of course. Yeah, I don't want a high deductible health plan because I didn't like the name. I said, I'm just going to take one for the team and try it out. And we ended up staying in it for 10 years beyond my husband's retirement. And like Walt said, we got $20,000 sitting in there that we can use to pay for future eyeglasses, whatever we want to use it for. If it's a qualified healthcare expense, it comes out tax-free. So it's been a great investment and a good way to save some money with excellent healthcare.
That's awesome. All right.
Yeah.
Well, I want to encourage everybody to keep your New Year's resolutions and follow through and make this the year that everybody really studies the whole thing, follows Walt and Tammy and Ed's excellent advice. And I hope everybody makes the right decision and check out the websites. And I will be in touch with everybody. And thank you again for your expert advice you've rendered today, you guys.
Thank you.
Thank you. Thank you.
Thanks.